Hey, it's Dr. Centeno, and we're going to talk today about an alternate way to measure C1, C2 rotation on a rotational CT scan. Remember, a rotational CT scan is where you take the patient's head, you're supposed to turn it 90 degrees to the right, 90 degrees to the left, and then take a CT scan looking at the rotation of C1 on C2 to try to determine if the patient is rotationally unstable at the atlantoaxial joint. One of the big problems with that is that very few patients other than hypermobile patients that have CCI can turn their head that far. But if we forget about that for a moment, I did one video on a different method for measuring C1, C2 on a rotational CT, and now this is yet another method. So you can see here that we have C2 and C1, and I've used this deviation marker to try to make sure I can determine the vertical to set my angle correctly. And again, we seem to have the same problem here with this setup, right? Where do you put this marker here? I'm assuming you want it parallel here to the spinous process of C2. But as you can see, there's quite a big variation of a couple degrees left or right where this marker could be placed. Now, with the patient's head turned the opposite direction at C1, we have even a bigger problem, right? Where do you put this marker? It's clearly not in the middle of the dens here because sometimes that's offset in these patients. Is it here? Is it there? Do you try to get it somewhere in between the two lateral masses? Again, the accuracy of this is going to be very low as a measurement. And then you subtract these two angles, C1 and C2, obviously on the same side. I have these on opposite sides right now. Again, the numbers used for this vary anywhere from 41 degrees to 42 degrees. As indicating pathology once you subtract out C1 from C2 angles. I've seen 44 degrees be used, but there's really no normative data that I can find other than the Dvorak study, which clearly shows that the pathologic value is 56 degrees at C1, C2, and not the 41, 42, or 44 degrees that I see being used out there. So again, just another discussion of these rotational CT measurements. Thanks so much for watching and have a great day.